Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spoke, and I'll be moderating today's webinar. Today, we'll be talking about 5 myths for mobile communication success. Bridget Wallstrom, Senior Product Manager of Mobile at Spoke, will share how to mitigate 5 key factors that impede success with mobile technologies in healthcare. Before we get started, I would like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we welcome your participation. Please submit your questions via the questions box, which is in your GoToWebinar toolbar, and then Bridget will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, so please feel free to share these with others at your organization. And lastly, at the end of the webinar, you'll have the opportunity to complete a short evaluation. We would love it if you could take a couple of minutes to complete this survey. Your feedback helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Bridget, who will begin our presentation.
Great. Thank you, Paige. Well, good afternoon, everybody, and thank you for joining the webinar. As Paige mentioned, today we're focusing on the 5 myths of mobile communication success. Again, Bridget Wallstrom is a Senior Product Manager responsible for our mobile solution here at Spoke. I've been with the organization for about a year. Prior to Spoke, I actually worked on mobile communication in an entirely different industry. And it's interesting because as you cross industries, there's a lot of parallels in terms of mobile communication success that carry over from industry to industry. But as I've learned over the last year, a little over a year, healthcare has some very specific needs as well. So I think be able to draw upon some of the needs and myths across the industry as well as focus specifically on healthcare. I think it's important first to start with really defining healthcare communications and what is unique about healthcare communications today. And really, healthcare communications is all about improving patient outcomes. A patient that's going into the hospital, you want to make sure you're providing that patient with the best possible care that you can, and making sure you're getting the right people to that patient to care for them. So Spoke offers a variety of solutions to assist with improving patient outcomes, really focusing on getting the right people to the right place at the right time. Examples, if you've got a hospitalist that needs to get a hold of an on-call cardiologist because there's some changing needs in the patient's changing conditions, you can quickly look for that on-call cardiologist and send a secure message to that on-call cardiologist asking for some guidance and direction on how to care for that patient. Spoke also supports the ability to receive and respond to those patient events to improve the response times to any of those critical workflows. So that's a little bit about me and a little bit about Spoke and how we're addressing needs in the patient care coordination. I think we really want to focus now on the 5 myths about mobile communication success. So I'll let you read these 5 here. I won't read them to you. Each of these 5 myths was drawn upon real-world examples that we've encountered by working with healthcare professionals such as yourself. You may hear these and wonder, okay, well, how did this happen? We'll walk you through some of the examples and how we were able to overcome these myths. So the very first myth that I have is number 1, adoption will happen on its own. Now, a question for you. I know we're all muted, but I'd like you to just think to yourself, how many of you on the phone are responsible for overseeing IT projects? How many of you are responsible for overseeing a mobile communications project or have had experience rolling out mobile communications projects? I think that's an important one to start with because all of these mobile communication initiatives usually start as a project, typically through the IT organization, not always. But this is a quote, actually some numbers that were pulled from the Project Management Institute. And if you think of any project that your organization is responsible for, according to the Project Management Institute, 56% of projects deliver less value than expected or anticipated. Now, nobody goes into an initiative thinking, oh, I hope I deliver less value. But I share this really because I want to, make sure that we're looking at, from the onset of this initiative, what can we do to tee this project or this initiative off with success? The second number I thought was really interesting is 80% of IT project leaders spend half of their time on rework. Making sure that you're teeing this project up to a point where the stakeholders engaged and involved fully understand the value behind this. Rolling out a mobile communication solution is a very highly visible initiative, and if your organization is like other healthcare organizations we've worked with, you're typically not only working on one initiative. You might be rolling out an initiative to upgrade to Office 365 at the same time you're rolling out a mobile communication initiative and having to work with a number of the same stakeholders on multiple initiatives. So making sure to tee yourself up for success by some of the things we'll talk about here will help you reduce some of these numbers that we've seen. So how can we maximize adoption? How can we make sure that we're teeing you up for success? I've got a number of examples here. I'm going to point out a few of these. So the first one we'll talk about is gaining support, making sure that you have leadership and champions. I think going into any initiative like this, it's really important to identify who your key stakeholders are and who those champions are. There's an organization that we worked with out on the West Coast that really did this tremendously. They had their CMIO that had identified IT leads as well as clinical leads on the physician side as well as the nursing side, that really pulled together to talk about what is the purpose for implementing a mobile communication solution, what are the problems that we're trying to solve, and by getting all stakeholders to the table to talk about it, they were able to really understand the needs from each of the different departments and look at it through someone else's lens. The CMIO also really set the stage for, here's what's expected of you, lead physician, lead nurse, lead IT person, to make sure that they understand what their role was in being that champion for their department, for their organization as this rollout occurred. One quote that I remember hearing while we were on site that I think is really important as well for leadership to really set the stage, that there will be things that we'll want to look at doing things different than we've done in the past. This CMIO, I recall them saying, I don't want to hear this is the way we've always done it, because we're looking at rolling out a mobile communication solution to improve the way we're communicating, to improve those response times, to improve the patient satisfaction scores. So that really kind of hits on the leadership champions, and also the encourage a culture of technology change. The next one I'll talk about in terms of maximizing adoption is really making sure to market the benefits. And so once you've got your leadership buy-in, you've got your champion's role defined, and you're starting to roll out your mobile communication solution, it's really important for the end users to understand what's in it for me. Why should I use a mobile communication solution that's directed towards clinical messaging versus using my standard SMS solution? I can already message this person in SMS using my text application. Why should I use this application? Helping these end users understand the benefits to them. They will no longer have to give out their phone number. They will no longer have to wonder, is this message coming across from my family or is this something that's work-related? Having a mobile communication solution focused for clinical needs can really, making sure they understand the difference between the personal solutions that can be used for consumer models and the benefits of the clinical solution. So one of the organizations that we worked with here in Minnesota actually set up a table. So their clinicians were able to stop by, have a chance to ask questions directly of experts of the mobile solution to be able to understand what the value was to them. So making it easy for those people to learn more about the solution itself. The last one I'll touch on here, and I'll let you review all of them, but the last one I'll touch on is really training beyond the application itself. So training people how to leverage, how to use the mobile communication solution. But as most of you who have had an opportunity to roll out a mobile communication solution may know, it extends beyond the application. The success of this rollout, the deployment, the adoption extends beyond the application, helping each end user understand what network they're tied to. Are they tied to a Wi-Fi network? Are they tied to a cellular network? Are there configurations that they need to set to make sure they can hear those audible alerts to notify them that a new critical message is coming through? Are there areas within your organization that have poor coverage, lead walls, that are outside of an application's control, but more of a communications barrier for end users to be aware of that could potentially impact that adoption? So that's number 2. Number 3, I like to call smartphones for everyone. And I'm channeling Oprah when she gave everybody a car. If you look under your chair, everybody's getting a smartphone. You know, if you're responsible for planning for a mobile communications rollout, you don't necessarily need to provide everybody with a smartphone. Now, if you are looking at providing people with smartphones, there are a few different models. So I'm going to look at this through 2 different lenses. First is a model I think many of us are familiar with, BYOD, bring your own device. It's very popular with physicians. Many healthcare organizations will allow the physicians to use their personal device. They're paying the cell coverage plan for it. They're using it to message their family, friends, other applications. But they're also seeing the value in a clinical messaging solution and will allow you to put a corporate or a business-related application on their phone. There's some pros and cons to each of these approaches, so I think you really, in a nutshell, need to look and understand what works best for your organization. The other model here that you might not be as familiar with, and there's a few different flavors of this, is corporately owned, personally enabled. It was a model we talked a lot about in my previous industry. There's corporately owned, personally enabled, which is as a IT administrator, we purchase devices and allow, maybe there's some physicians that don't want to use their own personal phones, we will allow you to use this device for corporate use, and if you send some messages to your family or use it to place a few personal phone calls, it's not outside of corporate policy. There's some organizations that have a corporately owned business-only policy. And your purpose-built devices would really fall into that category. So if you're deploying any purpose-built devices to your nursing team, those are typically preloaded with your business-related applications and shared amongst the team. Aside from the BYOD and the models itself, when you look specifically at BYOD, folks did a survey of a number of healthcare providers early this year, I think it was February of this year, and we found that the BYO trend is extending in hospitals beyond doctors to include the administrators, even nurses and IT. So if you are providing cell phones or are interested in rolling out a mobile communication solution, we are seeing mobile strategies that are extending their BYOD policy beyond the doctors, recognizing that that care team really consists of more than doctors and nurses. And additionally, as I mentioned before, it doesn't have to be a smartphone for everyone. We also found in our survey that it really depends on who is communicating and what their needs are, because you may find that an in-house pager, even a Wi-Fi phone, encrypted pager, there are other means of communicating that don't necessarily require that you deploy smartphones for all end users. That might be a lower cost for your organization. So that leads me to the third myth. The third myth is our Wi-Fi is good enough. We've got Wi-Fi, I'm already using it to access Facebook and Twitter. You know, having Wi-Fi in your organization is fantastic, but there's a difference between your consumer use of messaging and business-related use of messaging. When you need to get those critical alerts, those nurse calls, those critical test results, those critical messages, seconds after they were transmitted. So it's really important to take a really close look at the network coverage that you have. Again, the survey that we conducted earlier this year, the top challenges that we heard from the market space is really Wi-Fi and cell coverage are the biggest areas of improvement. Now, this isn't a surprise. Last year, these were also the biggest areas of improvement. I think the notable change to note here is that if I polled all of you and gave you a chance to answer and raise your hand, do you have known areas of Wi-Fi or cellular gaps or coverage barriers, coverage breaks within your organization? Almost everybody would raise their hand and say there's some area within our organization where I get spotty coverage, or it's just not quite as good when I'm in the elevator or when I'm in the basement or when I'm near the lab that's got some lead walls. There's known areas, and we're starting to see organizations making improvements to address those. So a few thoughts on what you can do to address those. First is identify the networks that you have in your organization. Some hospitals that we work with have a physicians network that's locked in for the physicians, but they don't allow anybody else in the organization to use that. Everybody else has to use a guest network, which has a captive portal. Well, if you are extending and rolling out a mobile communications solution, it's really important to understand the workflows you're rolling out, who will be leveraging and who will be communicating as a part of those workflows, so you make sure that you can get those people on and privileged to the appropriate network. Once you've identified the networks, as I mentioned before, these are business critical communications. So you have to make sure you've got SLAs in place and that you're testing these service level agreements. Just sending messages from different spots within the building to understand, are these messages getting through as quickly as I'm expecting? If you're responsible for the budget, making sure that you're budgeting for any improvements or even third-party assessments. We've worked with third parties. A number of our customers have worked with third parties to come in and do that wireless assessment, provide them a heat map to show them any areas of gaps or coverage that need to be revisited. That can be really helpful, but you have to make sure that that's something that you plan for. And oftentimes, it's not a one-and-done assessment, make the changes. It's something you need to continue to review and revise as you're expanding your communications throughout the organization, or if your building is under construction or you're adding new buildings, because that communication extends beyond the hospital as well. And then educating the users. We talked about this one before. All right, that leads me to number 4. So number 4 is, I gave them a phone, my work is done. And I think this kind of parallels off the adoption topic, but the quote here is really 63% of CIOs surveyed report their hospital does not have a formal process to quantify the success of mobile projects. We touched on this at the beginning. We want to make sure that you are setting yourself up for success. So understanding the why are we doing this, and how should we be measuring our success going into the mobile communications rollout is really important. And so we group these into 3 different categories. There's progress measures, process measures, and outcome measures. And so the progress measures really come into play when you think about the overall progress of rolling out a new mobile communications solution, the rate of adoption by end users. Are you able to quantify how many users have stopped sending SMS messages versus using a new mobile communications solution? Are you able to quantify the reduced exposure for any PHI being sent through unsecured methods? And then on the process side, are there specific workflows or processes that you were looking to make changes to? So as I mentioned before, we had the Chief Medical Information Officer that suggested, I don't want to hear this is the way we've always done it. If you have a process, let's say physician calls the operator, operator places a call to get or pages another user to have that person call back the physician. Maybe rolling out a mobile communication solution changes that workflow to allow the physician to search for that user in their directory and message them directly. Quantifying and working directly with that operator to understand how many calls have you been able to reduce through those lines and through those channels will help on the process measures. And then last is the outcome measures, and these are really the why. The why are we doing this? We're doing this to improve those critical response times to critical alerts, measuring how quickly are we able to respond to that code STEMI versus before this process was implemented. Have we seen any changes in our patient satisfaction scores, baseline versus after mobile deployment rollout? So these are really the whys, and these are things you don't have to wait till after. You can measure them baseline and then through your mobile rollout as that expands. Last but not least, number 5, myth in mobile communications is only physicians and nurses need a mobile communications tool. I think this statistic is really interesting, is that if patients visiting a hospital, on average, they're seeing 17.8 healthcare professionals during their hospitalization. So I actually had the privilege, I don't know if I'll call it that, of visiting a hospital about a year ago or so, that I was admitted to the hospital to be treated for pneumonia. And I, waited 3 hours in the waiting room, finally got admitted, was treated, and the nurse said, all right, I'm going to go let the doctor know we think you're ready to go. I'll have them put your discharge order in place. You can go ahead and get ready. We'll be back and have somebody up here to transport you and take you out of hospital. Now, as someone that didn't spend a lot of time in hospitals prior to joining Spoke, I got ready right away. I was waiting for about 20 minutes, peeking my head out the door. Can I just leave? How long do I have to wait? I feel better. Do I really need a wheelchair to take me out? Finally, someone came to transport me out the door. That's just an example of my experience. Having a mobile communication solution can really help expedite that. For example, you've got the doctor, okay to discharge, in this case, Mrs. Wallstrom. Okay, great, I'll place the discharge orders. Once the discharge order is entered into the EHR, you can automatically send a message or a page, in this example, to the transport to come up to the room and bring me out on my merry way. That could have helped reduce that wait time down so I'm not peeking out the window out the door, and improve my overall satisfaction. So to recap, the 5 myths about mobile communication success that we talked about today. Adoption will happen on its own. We discussed a number of ways to help with the adoption, including getting buy-in from your leads, clinical experts, your IT experts, having them come to the table and serve as your champions. Smartphones for everyone. Mobile communications, while you may think of mobile applications, and that's maybe a great solution for some of your care providers, it doesn't have to be the only solution. Our Wi-Fi is good enough. When rolling out a healthcare-grade communication solution, it's really important to have a solid understanding of your Wi-Fi and take the appropriate planning efforts, budgeting efforts, assessment efforts, training efforts to improve those. I gave them a phone. My work here is done. Understand the metrics that you want to track and measure so that you can show that your work here is done and that you have met your goals and your objectives. And then last, only physicians and nurses need mobile communications tools. We really see that it's expanding beyond the physicians and nurses to other care team members. Anybody that is actually interfacing with the patient could leverage some of the benefits. If you follow those 5 guidelines, you should have team members that are looking like this. A little cheesy.
Awesome. Thank you so much, Bridget, for that insightful presentation. We will take some time now to answer your questions as the audience. It looks like we've had a couple that were submitted already, but just want to remind you, if you do have a question, please submit it in your questions box in your GoToWebinar toolbar, and then we'll answer as many as time allows. So Bridget, first question is, what roles would you suggest to include in an initial pilot for a mobile technology project?
It's a great question. In terms of what roles would I suggest, I think I would go back to really understanding the why. Why are you looking at piloting a mobile solution? What are the biggest pain points within your organization? And working with the leads of those areas to identify maybe some people that could serve as champions to pilot the solution. I can tell you most frequently I've seen organizations start with physicians or hospitalist groups and expand out from there. So it will depend from organization to organization, but oftentimes I see it start with the physicians and even hospitalists depending on the needs.
Excellent, thank you. I have a couple questions about the stats from Spoke's survey. So will the report be published? If not, what was their sample size and details of the sample? Do you want me to take that one?
Please.
So those reports are published. You can find them at spoke.com/resources. And all the details of the sample size and participants are right in that report. And we'll also, for this particular attendee, be happy to send it to you offline, but let us know on that one. Another attendee has asked, seems like you're sending patient information in the examples that you shared. How is that staying HIPAA compliant?
Mm-hmm. So I can speak to the Spoke solution. I know there's a number of solutions on the market that address healthcare communication needs. But we do offer our Spoke Mobile, which encrypts data on the device at rest as well as while the information is being transmitted, so it is fully HIPAA compliant.
Excellent, thank you. Looks like we've got a couple more questions in the queue here. Speaking of the Spoke Mobile app, someone asked, what devices does your app support?
So the Spoke Mobile application is available for iOS and Android. So any devices that are supporting modern versions of iOS and Android that have the push services are supported by Spoke Mobile.
Excellent, thank you. Looks like we have one last question here. Bridget, an attendee, has asked, do you have recommendations on end user adoption and how to get them using the application?
Great question. You know, this is one that we hear a lot. I think there are a number of things that we can do to improve the end user adoption. Probably a whole separate webinar just on that topic alone. But it starts really with educating the end users, helping them understand the value and why your organization is choosing to roll out a mobile communication solution. That there's really value in having your entire directory centralized in a single tool versus using 3 or 4 different communication tools to reach different parts of the organization. There's training efforts that can go underway to assist with the adoption. I've heard of other organizations that continue to provide drip campaigns to their end users. So to provide you get limited time with end users to let them know here's the value of the system. And so I like the idea of the drip campaigns because you can start with the basics and then teach them additional insights in terms of what it can provide over time.
Excellent, thank you so much. It looks like that is the end of our questions today, so we will go ahead and conclude there. If we were unable to get to a question or comment, we will be sure to follow up with you offline. And if you would like to chat with a Spoke representative on the topics that we discussed today, you can do so using the link that is in your chat box. You can also continue the conversation with fellow attendees by using the hashtag #SpokeWebinar on Twitter. And follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spoke, as well as industry news and trends. Thank you all again for joining us. We hope that you found this webinar informative and that you have a great day.